Well, actually, I was going to say it is the truth that I am kind of a fill-in introduction for our speaker today, and actually, because I'm kind of a fill-in, Brad is going to give you a little bit of bio when he comes up here. But I just wanted to take a minute to tell you how I know Brad, because I've known Brad for 2 or 3 years now, and I have to say it has been a pleasure actually meeting with Brad. I serve on 2 committees at Fairview Southdale, their Community Health Assessment Committee and their Community Relations Committee. And it's just been a good relationship. We have worked together to try and create some stronger partnerships between the hospital and public health. We have most of our service area, there's a big overlap there. So it's been great to see the hospital reaching out into the community and getting some projects going out there. And it's been also great just to get our staffs together and to have more of that communication happening between our staffs at the front line level. So I sense a deep commitment on his part to his outreach into the community. And you know, a hospital is an important piece of our community. So I am really pleased that he is here today to talk more about Fairview Southdale and the new and innovative things that they're doing there. So with that, I give you Brad Beard, the president of Fairview Southdale Hospital.
Thank you very much for providing me the opportunity to be here today. I really appreciate it. Just a little bit on myself here. I actually grew up in a small town in upstate New York, and for all those baseball fans, I had the opportunity to grow up in Cooperstown, New York. So, fun place to grow up. I lived 5 miles outside of town on a farm, and but we played a lot of baseball, as you can well imagine. But it's a very small town of 2,000 people. But in the summertime, it went to 10,000, if you can imagine. Main Street, 3 blocks long. All baseball shops, if you can imagine. So it's a good place to grow up. I've been at Fairview actually for the past 28 years. I came in 1985, and I started at Fairview as a physical therapist was my background. Went back to school and got my master's degree in healthcare administration from the University of Minnesota, and then had the opportunity to be the president at Fairview Southdale for the past 8 years, about 8.5 years. So it's been a really fun ride for me here at Fairview. So I appreciate the opportunity to tell you a little bit about Fairview Southdale and a little bit about really an exciting project that we have going. And you may have actually, as you drive by the crosstown, you see the crane and you see a big hole, and an opportunity to tell you a little bit more about that. So we're very excited about this opportunity today. So I appreciate you coming today, and let you know I'm also a member of the Edina Noon Rotary, so a fellow Rotarian, and I've enjoyed that experience very much for the past 8.5 years. So a little bit about Fairview Southdale. Hospital built in 1965, so it opened in 1965. For those of you who are not familiar with that history, the mall, Southdale Mall, had been going here for a number of years. The Dayton brothers, who were kind of instrumental in getting that Southdale Mall going, went to one organization, another healthcare organization in town, and said, gosh, we'd like to have a hospital out here. We have a 16-acre plot. Would you be interested? The other organization said, no, we've already got a location identified. And so at that time, our founder, the president at that time, the CEO of Fairview, was a guy by the name of Carl Platou. And Carl heard about the Dayton brothers, were interested in, they actually were trying to sell the 16 acres. But Carl, being a great Norwegian, said, I'm going to like to meet with them. So he took them out to dinner, and they talked about their 16 acres, and they'd like to have a hospital developed there. And Carl said, well, I would be interested in talking to you about that 16 acres. And they said, all right, when would you like to meet? He said, well, how about tomorrow morning at 9 o'clock? And they said, okay. And they were in a room. I actually met at Edina Country Club for 2 solid days. And again, the 2 solid days, Carl had convinced them to donate the 16 acres to Fairview. And the quid pro quo was that you had to have a hospital up and operational within by 1965, by December 31st of 1965. And we actually opened, it was about 2 years away, we actually opened in October 5th of 1965. So Carl was a visionary. Again, at that point in time, Southdale was lots of open land, lots of open fields, and everybody thought, why would you ever put a hospital out in the suburbs? This is a really bad idea. This will be Carl Platou's folly here. And at the same time, again, as you look at what's happened, obviously he was a visionary. So Carl was just a wonderful, wonderful person and a great leader. So I'll flip to the next slide. That's great, thanks. So I talk about what are the 5 cornerstones of a great community. And we talk about great people, great schools, which we have great schools in Bloomington and our community, a great economic base, so strong business base. We talk about great public institutions, so a great city take care of roads, police, fire, all those things are critical. And we also believe great health care. And in Minnesota, we're blessed with great health care. Believe it or not, Minnesotans have the second longest life expectancy, only behind Hawaii. Now, I don't know why, but only behind after this winter. But only Hawaiians will expect to live longer than Minnesotans. And so if you think about that, we are blessed with great health care here in Minnesota. So at Fairview Southdale, we provide critical health care to our communities. Just a couple quick things that were ranked as the top 100 hospital nationally. So they look at 26 different diagnoses. They rank all hospitals, about 5,000 hospitals in the country, ranked as the top 100 hospital. Our emergency departments ranks in the top 5%. So the amount of emergencies that come through, they actually rate those. We actually rank in the top 5%. Nationally ranked in cardiac and stroke care. This is the best place in the country to survive, to have a heart attack and survive. Believe it or not, the CDC, Center for Disease Control out of Atlanta, Georgia, did a study. They looked at 40 major metropolitan areas. So New York, San Francisco, LA, Chicago, all the major cities, Atlanta. And they said, all right, if you have a heart attack, what are your odds of surviving, and where's the best place to have a heart attack? Well, they found actually that the best place to have a heart attack anywhere in those 40 major metropolitan areas was Hennepin County. Your odds of surviving there as compared to Atlanta, New York, LA were 4 times greater. So that's the good news. This is a great place. Not that I want you to have a heart attack, but if you do, this is a good place to have a heart attack. And again, if you look at the demographics, again, as the number of baby boomers, as we continue to age, again, you're seeing more and more heart things as we get a little bit older. We're rated A by Leapfrog. That's a national group out of Washington, D.C. for patient safety. So we take safety very, very seriously. How do we want to make sure you provide a great experience and a safe experience? We do not want to have anything that you didn't expect to have happen in the hospital. And so, again, we take that very, very seriously. In 2013, we provided almost 21,000 surgeries, so did about 21,000 surgeries, about a little over 3,000 deliveries. And so since we've been open, since 1965, 150,000 babies have been born at Fairview Southdale. So hard to believe when you think about that. About a little less than, or a little over 5,000 orthopedic procedures, about 871 strokes, and again about 42 to almost 43,000 emergency room visits. So pretty busy place. We see about 600 heart attacks a year, and it goes in streaks. I happened to be out to dinner with a cardiologist 2 weeks ago on a Saturday night, and he told me, he said, I may have to leave. He said it was actually at the Edina Chamber of Commerce event that they had their little gala, but he wanted to come, and I said, yeah. He said, but I'm on call, he said, and so I said, all right. So about 9:30, his beeper went off. He says, I got to go to the hospital. They're bringing somebody in who's having a heart attack. And so he left. And so the next day, I just texted him. I said, hopefully you got home. And he says, well, I got home at 5:30 that morning. He said, I had that one, and then 4 more, he said, came in one after the other. And I thought, oh, my goodness, to do. So he said, I did 5 catheterization procedures. They go in and he unclogs the artery that's been clogged as a result and caused the heart attack. So our patients are your residents. In 2013, we provided nearly 100,000 services to your residents. You look at Bloomington here, again, about 40,000 of your residents will use our hospital on an annual basis. So if you think your population, Bloomington, about 85,000. So you're looking almost a half of Bloomington will come and visit our hospital in one way or the other. So whether it be for outpatient services, surgery, inpatient, emergency room, it could be a host of different things. So it's part of our nonprofit mission. So we are a nonprofit hospital. So what does that mean? That means we have no shareholders. So any money we make goes right back into the hospital. So that's what a nonprofit status is. And so I've enjoyed working at Fairview for that reason, because I feel like it's a contribution to the community. We serve a lot of patients who can't afford to pay. Overall, last year we provided about $12 million to nearly 11,000 people for which we were not compensated. So anyone who shows up, we have to provide care if they show up to our emergency room. And so that's part of our mission, is we recognize that we're here to improve the health of the communities that we serve, and that's part of the role that we play. Our team members are your residents. We have 1,300 employees, as well as physicians and volunteers from your communities. Over 40 real estate locations throughout the community where medicine is practiced by Fairview Southdale. So if you look at the hospital and then look at all the other medical buildings that are around that hospital, you have about 43 other buildings that actually have an impact that we think is impacted by that. Several thousand people each year attend health education and community events, and the medical landscape of the community exists because of Fairview Southdale in terms of what's happened around that whole Francis Avenue corridor. A healthy Fairview Southdale, we think, is a healthy community. Our economic impact, we think, is significant. One of the region's largest employers, again, as you look at how many people we employ, We help the community thrive economically. And this was we looked at a group called Implan. They looked at overall impact of having a hospital our size. They do numbers, looks at more than $769 million on an annual basis. Studies estimate that 1 in 9 jobs in a community can be attributed to the existence or the economic impact of having a hospital. So it's a significant impact. We're a comprehensive hospital with 5 Fairview primary care clinics, pharmacies, and more in our community. And you expect us to be there when you need us and deliver outstanding care. Again, I go back to, I think, about 600 heart attacks and about 800 and so strokes that we do each year. Those are those things that are time sensitive, that minutes are important. If for every 5 minutes you wait, you actually decrease your life expectancy by 1 year. So timing is critically important if you've had a heart attack or that type of thing. So that's why I say, don't ignore the symptoms of heart attack or stroke. Get to a healthcare facility. So as a local hospital, we're dedicated to providing exceptional care to each patient every day and making our community stronger. So we really try and figure out what things can we do in the community and how can we be involved in the community to really try and provide better health care. And I'll give you an example that I feel really good about, and I know Karen referenced a couple things, but another example is probably 5 years ago, I think Les had an opportunity to interact with us, and we actually partnered together on the Pond Clinic, which is in a Bloomington school system building, and we provide a pediatrician there each week, and they provide health care to students in the Bloomington school system. So it's if they can, it's free. If they have no health insurance, we'll take health insurance, but there's no out-of-pocket cost for them. So it's a way for us really to give back to the community in a way to provide health care. And that's been a wonderful partnership that I think has gone really well and has worked out both good for the schools and as well good for us. So Fairview Southdale, so what's happening? What's our project? So our project at the hospital currently is, we're adding a new emergency center onto the hospital. It will be named after Carl Platou. And Carl was, like I said, was a visionary for Fairview. He worked at Fairview for about 38 years. So he spent 38 years. He came to Fairview as, believe it or not, as a 28-year-old. At that point in time, when he came to Fairview at 28 years old, there were 30 hospitals in the Twin Cities. And Fairview was the 28th in terms of size. So he started as the 28th smallest hospital in the Twin Cities. And when Carl got done, after his 38 years, Fairview was, at that point in time, we were the 2nd largest health system in the state. And so Carl took us, started with 1 hospital, developed Southdale, then Ridges, then up in Princeton, and then up in Wyoming. We actually, and then have a hospital up in Hibbing as well. So Carl took us from a very, very small footprint to a much larger footprint. So a group of his friends got together and said, we would like to name this new emergency center after Carl Platou. So it was a very, very nice gesture. So largely unchanged and scope and size since 1985. We have about 15,000 square feet. Was built to serve, we thought at that point in time in 1985, about 30,000 patients would be a good number. Today we currently serve nearly 43,000 patients per year and growing, including 1,400 trauma injuries and about 10,000 ambulance arrivals. So every day we see between 30 and 35 ambulances come to our hospital bringing patients from the community. So it's a busy place. 25% of the emergency patients are admitted to the hospital for further care, so we actually admit 25%. National norm is about 15%. You say, now why is it that we admit a lot more patients? The reality is our average age is north of what we would consider the normal would be. So as a result, you have more seniors and they're getting admitted more often. Space and wait times can sometimes reach 3 hours due to space limitations. Our space and privacy for families and patients is limited. The current room size, at that point in time, believe it or not, in 1985, it just didn't have all the technology and the equipment we have is between 80 and 100 square feet. The reality is today, with all the technology that goes in the rooms and the things we can do, we really need rooms that are about 160 square feet. So that's really a challenge for us. Ideal is closer here, it says to 150 to accommodate family members, care team, and technology. And we're unprepared to deal with a disaster. We always think, what if something, a significant disaster occurred at the airport, or the Mall of America, or even any type of pandemic type of event. We really don't have the facilities that would really stretch us to do that. So part of our new space, we actually will have that. We'll have the ability to have people that will be, if they need to be decontaminated, they can actually go through a complete facility at our hospital. The demand for Fairview South will grow due to the location and high quality that saves and changes lives. So I'll let you go to the next one. So this is the new emergency center. So we will add on, this is the crosstown out here, all right, and this will be, we'll add on actually 2 floors. Actually, there'll be 1 underground and then 2 floors above ground. So the emergency will be here. It's about going to be right around 40,000 square feet that we'll add on, that will be new space. On the second level is a really unique feature of this new space is going to be what we call, it will be for observation and chronic care. So very, very new idea in terms of how healthcare is provided. We have a number of people that have concerns like diabetes, or diabetes gets out of control. As you look at those patients with like diabetes, or people have, oftentimes people have migraine headaches and they need some medication, they need to be in the hospital anywhere from 6 to 18 hours. We'll actually have a space where they can be seen in the emergency room, immediately moved right upstairs and get their treatment, and then be released before 24 hours is up. So we'll have initially start with 24 observation beds and chronic care beds, and then we'll move to 30 beds at some point in time. So really a way we're trying to eliminate, right now today we actually put them into the hospital, and that probably isn't the greatest use of resources as we look at this. So this is very much a needed space. So on the second level we'll end up being 30 chronic care and observation beds. The emergency center will also have some unique features in the fact that when you come in, we'll actually triage you. And if you're need an urgent care, let's just say you want somebody to check your child's ears to see if there's an infection, or you have something that would be very easy to treat, you just need some minor stitches or something like that, we'll actually shuttle you to an urgent care space. You'll get that care taken care of and be in and out, we hope, within less than an hour. Right now, currently, you go into the queue, if you will, and we take care of more severe people first, and then you kind of are at the back side of that. So your wait can be a little bit longer. And so this new setup will actually allow us to have urgent care as well as what we call true emergencies, the heart attacks, the strokes, and things like that, abdominal pain that may need a little bit more care. All right. Our project objective is really to build and create a state-of-the-art emergency center to meet the future care needs of our patients of the growing community. And we want to serve as a model of care by creating exceptional clinical outcomes, efficiency, time, and cost savings for patients. So we're really trying to say, as we look forward in the healthcare world, what's going to happen? You know, again, I think we'll see less use of inpatient beds and much more use of what we call outpatient or ambulatory care. And so we see the emergency room as really a critical step for us to be able to provide our community. Today, we are woefully undersized. Like I said, we built to see 30,000 patients. Today, we see about 43,000 patients. And in all honesty, if you come in on a Friday night, Saturday, Sunday, and Monday, it's a busy, busy place. We can have 29 rooms all filled and have 25 people in the waiting room who are waiting to go back. And that really creates a backup, and that's a challenge that we want to eliminate with our new setup, and this will hopefully will create a much better flow. So this is our current footprint right here in the yellow, and this will be our new expansion that you see the construction going on right now, the crosstown being right out here. And so we're expand that. Today the ambulances actually come in here and go out here. In the future they'll actually come through here and come right out of here. This will be the ambulance garage in the future. So we're very excited about the opportunity. Today we can fit 4 ambulances in our garage, and it's really tight to do that. Our future allows us to fit 6. Today we have 29 rooms. The future will actually allow us to we'll have 43 rooms, and then plus we'll have some additional urgent care rooms that will allow us we can actually expand that. And we've actually built it to, if we look at our projections right now, we have an urgent care on one side of the hospital, and we have the emergency room on the other side. We will actually combine those together. So when we combine those volumes together, we'll start out of the chute at about 53,000 visits. Today, urgent care see about 10,000 visits. The emergency room about 43,000. So we combine those together, it'll be about 53. We're building this to serve about 70,000 visits on an annual basis. So we're trying to build it hopefully for the future. We won't have to do this again for, I hope, a long, long time is my hope. All right, next one. So additional 45,000 square feet of space for the emergency room. Increase our patient rooms, I said 30 to 43. We put a new helipad XX on the 3rd floor. It used to be in the front of the hospital. We put it up on the 3rd floor. So helicopter, the pilots like it a lot better. They say instead of coming in, they only had about 110 degrees of flexibility to come in. This new space actually allows them about 145 degrees, so they like that. And we get helicopters from all over the state, bringing in heart attack patients and stroke patients and those types of significant injuries like that. Increased size of the trauma rooms today will allow us, again, we'll have what we call 3 red rooms. Those are when people come in with a heart attack or stroke. They go in there, lots of materials and technology available to help them. efficient admitting and welcoming areas, improve patient flow. You're really trying to create a healing environment. How do we meet our patients' needs? So this is the unique feature of our new emergency room. Will actually be what I call an on-stage, off-stage. So patients and families will actually enter a room. There'll be 2 doors in every room. They'll enter the room from the outside. All the staff and all the equipment and all the busyness will actually come in from the inside. So the physician, the nurse. So there'll actually be, so all this that goes on, all the things that go on behind the scenes, the patients won't have to see. It'll be much quieter. It'll be a much more calm and better setting, and we'll have what I call the on-stage area and the off-stage area. And so we think this is a great new design that will allow us to provide much, much better care for our patients. So we're really excited about that. And again, I think the ability to serve a growing number of chronic care patients. Again, if you look at chronic disease, we're doing a better job of treating it. People are living longer, but certainly there are hiccups along the way, and so we want to be there to be able to help those patients with that. So our cost of this actually is about $42 million. So it's a $42 million project. It's a significant project. As a company, Fairview is a company, again, we're a not-for-profit company. In order for us to be successful, be able to reinvest back in the company, we need a margin that's probably about somewhere between 5 and 6%. Healthcare, I wish I could tell you we had a 5 or 6% margin. We don't. We usually have right around a 3% margin. So we struggle with that difference between 3 and 5. So how do you do that? Well, we've really done a great job with philanthropy over the last few years and trying to talk to people about what are needs of the hospital and would people be willing to help us with those needs. And so that's one of the things that we've been out with this project. We're attempting to raise that $15 million. We're about $3 million. We need about $3 more million. So we've done well so far, but we're still in that final stages here. We need to raise that money by December of 2015. So that's actually, I'm going to ask you for your consideration to think about coming together with some of the other Rotary clubs and getting opportunity maybe to come together and consider supporting this project with all the other Rotary clubs in the area. So that's why I wanted just to plant that seed in your mind. Next one, if you would. So we talked about, I just kind of talked about this, so I won't go through this one. So Fairview Southdale, we do need your partnership to continue providing the community at the highest levels of care that they need and expect, and be part of our legacy of compassionate, quality emergency care for everyone in our communities. So I'm blessed to live. I have a wonderful wife and 3 daughters. My wife and I, we have 3 daughters, and my kids. I bring home my schedule sometimes the day before, and they look at my schedule and they say, "Dad, what do you do at the hospital?" They don't have any idea what the president of the hospital does. They say, "All you do is go to meetings." Yeah. They look at my thing. I'm started at 7 in the morning and get done at 5 in the afternoon, and they said, what do you do all day? I said, it looks like all you do is go to meetings. And I said, well, that's a lot of what I do. But I said, I get a chance every now and again, I said, to go out and talk with patients. And I said, that's probably one of my highlights, is the opportunity to just go out and talk with patients. And they said, well, tell us an example. And I said, well, here's a great example. And this was happened to me. I happened to walk out into the lobby, and there was a woman. She's probably, I would say, in her mid to late 30s. And she's sitting in a wheelchair, and she was obviously waiting to leave the hospital, be discharged. And so I walked up and just introduced myself and said hello to her and said, how are you? I'm Brad Beard. How was your stay? And she said, great. I had a good stay. And I said, anything you do to improve? And she said, no. She said, I really had a good experience. And I said, do you mind asking what you came for? And she said, oh, sure, I'd be happy to. She said, I had brain surgery. And she had a full head of hair. And so I thought, wow, interesting. I said, well, what happened? And she said, believe it or not, she said, 2 mornings ago, she said, I woke up, and she said, I just didn't feel right. Didn't feel good, she said. So I went down to the bathroom, and she said, and I remember using the bathroom, and then all of a sudden, she said, I got up from the toilet, and she says, I don't remember anything after that. And she said, and my husband found me on the floor, called 911, and they took me to Fairview Southdale, and they quickly identified, we have a CT scanner that is ultra fast, and we were able to actually find where in her brain there was a clot. And to be honest with you, we bought this CT scanner about 2 years ago. And before that, it would take us about 35 minutes to actually identify that you could find where it was in the brain. So complicated. And so it would take about 35 minutes. They do the CT scan, they didn't have to analyze it and then figure it all out. Well, this new CT scanner takes about 5 minutes. So in 5 minutes, they found the exact blood vessel in her head. And then she said, then what they did was, she said, they inserted a catheter into my thigh, into a blood vessel in my thigh. They pushed it all the way up through my heart, up into my carotid artery, into my brain. They pulled out the clot, they put in a stent, and she said, and then all the blood started flowing again, and she said, and then they pulled everything back out again. They left a stent, I have a stent left in my brain, and she said, I suffered a stroke, and they told me that if this had happened 5 years ago, she said, I would have probably been paralyzed on my left side for the rest of my life. And she said, and I'm going home. She said, after 2 nights at your hospital, I'm going home. She said, I'm going home. I don't have any deficits. I can talk normally. No deficits on my left side. And she said, and I'm going home to my 2 kids and my husband. So she said, so I'm a happy person to have you come to this hospital. I said, yes, you should be a happy person. Because that's it's a great story when you think about just, you know, the type of care that what I call life-saving and changing care. And we talk about saving lives and changing lives. And so that's a dramatic story. I certainly admit that. But at the same time, it's just a great story. And I'll tell you one more, just because he happens to be a Bloomington resident. And some of you may even know him. But he was out skating. Skates with a group of guys, and they're all in their 70s. And they're out skating. They skate a couple mornings a week here in Bloomington. They're out skating. He said, you know, we go out and skate, and we're playing hockey, no check hockey, early in the morning, and I'm out skating, and I'm going up and down the ice, and all of a sudden I don't feel so good, so I go over to the bench, and the next thing I do remember is blacking out. And then buddy saw that he was blacked out, came over, sent somebody in to call 911, I got an AED, they shocked him, got his heart going again, they brought him to the hospital. Actually, believe it or not, by the time he came to the hospital, he was unconscious, but they shocked him. By the time they got him to the hospital, he was talking. They took him in, and they found out that he had several vessels that were almost totally clotted, and he was lucky. I mean, he was just lucky. They went in and did an open heart procedure, cleaned out 3 vessels, and he said, you know, the only thing that's bad about this, he said, they tell me that I can't play hockey anymore because my chest, he says, if something happens, they crack his chest open to do it. He said, no more contact. I can't take a chance of falling or anything like that. But just a wonderful person to get a chance to chat with. But he talked about, you know, wow, I was so fortunate to have great care in this community, and certainly he was. So he just did a great job. So with that, I'm going to actually, I'm going to show you a little video, and then I'll open up for some quick questions, if that's all right. You want to go ahead and cue that up?
I collapsed in the shower.
Lois was unresponsive. They're bringing her to Fairview, Southdale. The ambulance drivers, I remember, said, we're sorry, we couldn't do more. And then I started to get worried. She had had a massive bleed into the brain from a ruptured aneurysm. She was not expected to survive.
I didn't understand how sick I really was.
Then the testing began, and that's when I started to feel the rhythm of the hospital, people coming and going. It was a very comforting thing.
The care that I had at Fairview, Southdale was excellent. And the doctor, he saved my life.
Our hope would be is that they never have to use our emergency center, but if you do need it, we want to be there for you and be able to provide you with the very best care.
Life is good.
Fairview, Southdale was part of that giving back our life, making possible our hopes and dreams. And it all started in that emergency room.
At the emergency center, it's really what I would call the front door of the hospital. It's where most people interact with our organization. And our current emergency center was built to serve about 30,000 people. And today we serve about almost 43,500 patients a year. And so we're really very undersized in terms of the need.
We've been part of the Fairview Southdale Hospital community for over 30 years now. The emergency room looks very, very similar to what it's looked like over the long period of time that we've been going there.
Unfortunately, we have storage issues because of space, and so a lot of our equipment we've had to place in the hallways, and so you can see how we had to be creative with space to make sure we have proper patient flow.
The rooms are much smaller, so to have the physician, the scribe, the RN, and have the EDT and the patient, once you get all of those individuals in a room, it gets to be very, very tight.
We admit our patients exclusively here to Fairview Southdale. So when they have a need for inpatient or emergency care, this is where we'd like them to come. And when my patients are in the ER, I have real-time access to their images, to their labs. The ER doc will call us. That coordination of care just leads to such better outcomes for our patients.
Fairview Southdale. It's become such an important asset to our community in so many ways. They've helped our residents live better lives, and I think this emergency center is just the next phase of that.
I think it's very important that the community step up and help out with the hospital. That's why my husband and myself have decided to be very involved with this. This is our hospital. It's where we go for care.
We've been exceptionally pleased with the care. When we walk in, right away there's skill, there's caring, they're fast, they're comforting.
Fairview Southdale is not the closest hospital. The care was so good. We really appreciate everything they did for us. We've decided that that is our primary care hospital, and we will travel a little bit farther to get that type of care.
Benjamin and two of his friends and I were going to go play disc golf.
I went up to get it, and on my way up, I fell down.
I ran down to his side, and I could see right away, actually, that he was turning blue. He was in full cardiac arrest. I was pretty sure that Ben had died.
We're proud that we're one of the top cardiovascular centers in the country.
We see about 500 to 600 heart attacks here a year. In 3 of the last 5 years, Southdale Hospital had the #1 outcomes in the state of Minnesota. The emergency room is everything.
We help train the paramedics, and we're connected to them now electronically. So paramedics pull up into your driveway or into your office building, you're immediately in touch with the physicians at the emergency center. So therapy or healthcare begins while you're en route.
I saw lights and sounds and people, and it was just the best thing for me to know that lights and sounds and people were there taking care of Ben.
Their goal was to keep him alive, get him into the state where he could then get treatment, and that's what they did.
I know that I wouldn't be here today without Fairview Southdale.
I feel gratitude every day. So grateful for all the people that were in the right place at the right time, who knew what they needed to do, who did the job that they needed to do.
Fairview is a nonprofit hospital, so there isn't enough left annually to support these major improvements like this. That's why this not-for-profit hospital has asked us to privately raise $15 million to support the facility we wish to build. Consider the value of having a top-rate hospital and a top-rate emergency center at your beck and call. Our properties are worth more simply because we have immediate access to a first-class hospital and a first-class emergency center.
You can't decide when you're calling 911 because you're having chest pain or you're having a stroke to write out the check and make the donation to build the emergency room. You're expecting that the emergency room is going to be there, it's going to be state-of-the-art, it's going to have all the cutting-edge equipment.
All of that adds up when the need comes to be worth an awful lot. So we're asking people to help us support this facility, primarily because we need to build it and we need some financial help to do it.
This is really the first time we've actually gone to a community and asked for community support. We save lives and we change lives by the care that we provide each and every day. And we're really asking the community to step up now and help us in our public phase of this campaign and raise dollars to help us make this new emergency center a reality.
This change in our emergency room needs to be world-class. This is our chance to literally recognize the great care that's gone on here and leverage that care so that we can take care of our community.
Why wouldn't we make it the best we could? They say Ben, obviously they're willing to invest in better technology, so let's keep going.
If it's a resource that you use, it's a resource that you help support.
All right, and so part of, just so you know, we had a chance to, as Jeff O was gracious to allow us to come to all the presidents of the district meeting here back in January and talk a little bit about all of the Rotaries coming together to consider this project as something that they might want to support. And so one of the things that we talked about was a chance to come out to talk to each of the Rotary clubs. So we've been to Edina and to Richfield and to Bloomington. We were at the Bloomington Morning Club as well. And just the opportunity to chat with all the different Rotaries, just to let you know what we're doing and maybe answer any questions you might have. So I know you had a couple questions. Yes? Yep.
I think a couple of questions. One, I'm so happy to see that the by increasing the space and the technology for the emergency room, we'll be able to attend more patients and at the same time reduce the wait time. I don't know if you have seen this. I travel to Florida and I see a lot of billboards from different hospitals. And they talk about the wait time, and it's a thing we
Changes every
8
50
minutes.
minutes, yes, yeah.
8 minutes, 11 minutes. 10
We
minutes.
probably will do that as well. Put a billboard up and actually have, 10-minute wait time in the emergency room right now. So we'll
And
probably
that-
do the same
and
thing.
it's only possible if you triage the
Right.
most important ones.
Right.
So that's nice that you're doing that. The other question was just for information. How do you compare your hospital with the Abbott Northwestern?
So yeah, if you look at like our cardiologist Steve Batista over there, we actually compare very, very favorably. If you look at 3 of the last 5 years, we actually had the top cardiac outcomes in the state. So we also had some of the top stroke outcomes. So we compare very favorably to our competition. And again, I will tell you this: in Minnesota, we are blessed with great health care. So you could go to, whether you go to Abbott Northwestern or you go to Methodist Hospital or you go to Fairview, Southdale, you will get great health care. We are very, very fortunate to have outstanding health care here. So, but we compare very, very favorably. If you look at, like, my example would be this. So Joint Commission, which is our national regulating agency, we have been a top performing hospital the last 2 years. In Minnesota, there were only 3 hospitals that were a top performing hospital. So one was Mayo, Fairview, Southdale, and Regents Hospital over in St. Paul. Only 3 identified. So again, we compare very, very favorably when you look at outcomes, clinical outcomes. So another question.
I was delighted to hear that you're putting an urgent care facility in front of your emergency room to do some triage. One question is, what has been the impediment to every hospital in the country not doing this 20 years ago? The second question is, I've run into a couple of people who have gone to the emergency room, been admitted to the hospital, and found out 3 months later when they get a humongous bill that they were under observation. And are you working to fix this?
Yeah, so actually the observation status before even, and this is observation status has happened in the last 3 years. So what's happened is Medicare, CMS, we call CMS, but Medicare, what we know as Medicare, they are constantly changing the rules, if you will. So it used to be 2 classes. You were an inpatient or an outpatient, one or the other. So if you spent a night in hospital, you were an inpatient. And then about 3 years ago, Medicare said, in order to cut costs, we're going to actually have 3 statuses now. We'll have outpatient, observation, and inpatient. And obviously the observation is a lot less expensive than the inpatient and a little more expensive than the outpatient. And so what happens is Medicare now has a new rule that you're an observation patient unless you stay 2 nights, okay? Then you become an inpatient. So you could be in the hospital basically and by 2 nights you could be in the hospital 71 hours, what you would consider almost 3 days, and then be sent home and you still would be called an observation patient. So what happens is, if you're an inpatient, your certain set of benefits kick in. So, and it pays for most of your bill. If you're an observation patient, you may end up with 20 or 30% of your bill because of your status that's determined by Medicare. So we have an ongoing legislative battle with like the CMS around to fix this, because patients feel like if you've been in the hospital, you've actually been in a hospital bed for 2 days, you feel like, oh, I'm an inpatient. But the reality is you may be classified as an observation. So we're trying to do a better job educating, but I appreciate the question and understand that.
One other question, and Brad, would you stay after the
Oh, I'd be happy to, and I apologize if I've gone over here a little bit.
One other question.
One question? One other question?
Could you explain the partnership you have with the University of Minnesota Medical School? I see their logos on.
Yeah. So the Fairview system, we partner with the University of Minnesota health system. So if you look at our 6 hospitals, University of Minnesota Medical Center is it's the largest hospital in our system. So we have a number of University of Minnesota physicians who are at our site. So our cardiologists are from the University of Minnesota cardiology group. Our intensivists who run our ICU are our NICU doctors, so neonatal intensive care units are from there. Our oncology physicians are from the University of Minnesota. So we have a partnership with the University of Minnesota, and we have access a lot of times to the education and research that occurs with that. So it's been a great partnership. We've learned a ton from them, and again, it provides them with another clinical outlet to help train their future physicians. So we have residents and fellows as well who come down to Fairview Southdale. But it's been a good
So
partnership.
you're teaching?
Yep, we do some teaching. Now, not every service, but a number, like our colorectal surgeons, our oncologists, our intensivists, all actually teach fellows and residents come through our facility. So, all right. Thank you very much. I appreciate your time. So thank you.
Well, Brad, thank you. On behalf of the Bloomington New Notary Club, I want to give you a little gift.
All right, thank you.
Thank you for gracing us and giving us all the information that we wanted to know about Fairview Southdale,
Right.
which is a great facility, by the way, because my wife had her surgery there on Thursday and everything turned out okay.
Good. Glad to hear that.